Vivek Sharma and you are watching me on various platforms and I talk about cancer and mental health. And with me is Dr. Prasun P. Dr. Saab is a palliative care physician and let us understand from him that what does palliative care means, because there is a general perception that palliative care means end of life care. Is it true, doc? And if not, then what is the truth?
Thank you so much for this opportunity. So, I am myself Dr. Prasun. I am the lead consultant palliative medicine at ACTREC. So, ACTREC stands for Advanced Center for Treatment, Research and Education in Cancer. So, if we are running a palliative medicine department there, that means that first thing, it's not end of life. It started as something for end of life, but it's no longer end of life. Just imagine it as an extra layer of support that will help you improve your quality of life by managing all your sufferings. So in the era of new immunotherapy and targeted therapy, the survival is definitely prolonged, but it comes with the suffering with it. So what if the suffering is also reduced? So that is what palliative medicine does. And also, if these do not work, and if you end up into a stage where there is suffering, then we reduce that and make the journey very peaceful for you. So it is not end of life. So, and I also want to emphasize that it is for any age and any stage of the illness. Maybe it's a curative disease, maybe it's not a curative disease. It's an extra layer that will reduce or eliminate all the sufferings that you have, so that you lead a peaceful, healthy, long life or a peaceful end.
So, doc, tell us that what does palliative care means? Like what all aspects of the treatment or the wellness is covered in this?
Okay, so it encompasses all the aspects as a person. We do not look at you in terms of lab values or scan reports. We look at you as a person, and it includes the physical component, that is the pain, breathlessness, or something that the physical symptoms that you experience. It also considers the psychological aspect of it, which is the anxiety, stress that you are dealing with. It's also covered in it. We also look at the social aspects of it, how the family or how the relationships are there and what we can do to improve that. And it also covers the spiritual aspect of it, how you spiritually tackle the disease. So overall, helping you in a holistic way to improve the overall well-being or the quality of life.
That's good. One more question is there, like many of the times the palliative care physicians, whomever I get in touch with, they are having this complaint that doctors they or the treating physicians, they refer the patient very late to the palliative care physicians. So when should be the right time to refer to a palliative care, and when this has to be included?
Okay, so the right time. So there have been developing new guidelines as well as ways, as we are coming with new therapies and dealing with new challenges. So referring the right time to refer to a palliative medicine guy is when the cancer is in an advanced stage. First, when you diagnose the cancer to be in advanced, or if the patient has suffering, which the patient says that it's distressing enough for him that whatever may be the disease condition, whether it be curable or not, if the patient is having a distressing symptom, the patient can be sent. Otherwise, on the diagnosis of an advanced disease.
Is there any scale or something that the patient or the caregiver can understand that, okay, whether this is the framework wherein they can analyze or assess whether the patient or the family needs a palliative care support? Is there something?
Yes, so the simplest one is called as an ESAS scale, which we normally use. So ESAS is Edmonton Symptom Scale. So it ranges from 0 to 10. So 0 means no symptom at all, and 10 means the worst possible symptom. So for there are a number of symptoms in that, including pain, breathlessness, dyspnea, etc. So if your symptoms lie somewhere between 4 to 10, if it's 4, 5, 6, that's moderate. You may be tolerating it, you may not be tolerating it, and if your normal medicines work with it, then it's well and good. But if it's going beyond 6, like 6, 7, 8, that's the severe suffering, then you can come to us.
That's great.
So we'll make sure that it is reduced.
Amazing. That's great. Thank you, Dr. Prasun, for being with us and enlightening us on in terms of palliative care and its intervention, its role. And you had been watching me, Vivek Sharma, social entrepreneur, with Dr. Prasun P from Tata Memorial Center, ACTREC, Mumbai.